and gentlemen, on the other side, we're looking at this new year beginning with a new outbreak of a virus due to this new HMPV virus, which has surfaced in China and has got the whole world worried. The videos on social media of chaos have literally brought back the memories of COVID-19 pandemic when it entered our lives 5 years ago. 3 cases of HMPV for human metapneumovirus have already been reported in India, 2 from Karnataka and 1 from Gujarat, and all these 3 cases involved infants. The government has assured that there is no need to panic. Union Health Minister Mr. JP Nadda today said that the centre is closely monitoring the situation. Most importantly, the government has also said that it is not a new virus. It has been in circulation for quite some time and it was first discovered in 2001. The expert who identified this virus is now joining me live. Joining me this evening is Dr. Bernadette van den Hoogen, joining me live on the show. Also joining me this evening is Dr. Raman Gangakhedkar. Good evening, Dr. Bernadette. And my question to you is, first one that is on everybody's mind. This is not a new virus, we're being told, but how dangerous is it? And is there something that we should be worried about taking us back to the pandemic COVID-19 days?
Good evening. Thank you for having me. You had a lot of questions. First of all, the virus is already circulating for more than 60 years in our population worldwide. So there's not a new virus, and it's also not a threat for a pandemic. Every person gets infected before its 5th birthday. Everyone gets the virus. It's just a common cold. All children will run into this virus and have a common cold. It's not a dangerous virus. There should not be any worry about it. When you encounter the virus, you develop a common cold. And only very young children and elderly, and maybe with patients with underlying disease, might develop a severe disease, but it's not like COVID.
So let me ask you, we've already had 3 cases being reported in India, and these are in infants. Are infants more susceptible? Is this likely to be life-threatening at any of these times?
No, it's in general not life-threatening. And as I said, all children encounter the virus. All children are being infected in their life. It's not just this year. Every year there are epidemics. Just like all the other cold viruses, you get a runny nose and maybe a cough and a sore throat, and that's it. With children, they go through so many common cold viruses, and most of them just come through it pretty okay. And only in a number of cases, very low number, the children need hospitalization. But even then, it's not deadly, there's no concern. But everyone, every kid will get it. And the virus goes around every single winter. So the 3 cases you see now it's like there must be way more, because it's a general occurring virus.
So then why is there such a scare after social media has videos being reported from China? Is it the same virus in China? Is it a different strain? Because there is an emergency that has been declared in China.
Yes, well, I don't know the details from China, of course. But
nobody knows.
In general, it's the same kind of virus that spreads out over the world in the winter months or early spring months. And why China, and even China is not declaring an emergency state. They just see a rise in respiratory infections, not only with human metapneumovirus, but also other viruses, which is normal in the winter. We have a rise in respiratory infections caused by several viruses. Right here in the Netherlands at this moment, it's the RS virus. In China, it's metapneumo. And maybe China brings it out because they don't want to have the same guessing as was for COVID. They just bring out all their numbers right now, but it's not so severe what they see. And that's what they say themselves as well. They see a rise, but it's not severe.
Okay, but Dr. Raman, China saying it's not very severe. Should the world heave a sigh of relief or take it with a pinch of salt? These days, we don't quite know what to do when information comes out of China. But having said that, do you think there's need for surveillance in India, given the 3 cases that have surfaced today?
Now, 2 things to answer, no? Whether we should believe China, I think we believe the COVID publication that they made on 31st of December in 2019. No, we cannot brush off China in a negative manner. At any point in time, they had even published the genetic sequences for COVID virus. Now, the second issue is, should we have surveillance? Yes, we have surveillance. If you look at what we have published from our country, ICMR, National Institute of Virology, in 2016 and 2018, they had studied close to about 16,000 samples of patients who had acute respiratory infection or SARI, ARI or SARI. SARI is for those who get admitted with acute respiratory infection. And what was found among ARI cases, our 3.4% of them had this particular virus. When it comes to SARI cases, there was 2.6% of people who were tested. The numbers are large enough. 9,000 and perhaps 7,000 is a fairly good number, and it was 2.6% for SARI cases. So surveillance we could always do, but we have to remember that this is a mild infection, doesn't pose a public health problem. Shall we spend so much of money in looking at this particular virus in the panel that we test? Is a question which government have to decide. But ICMR has been doing these surveys, as I know when I was reading there.
Okay, well said. But Dr. Bernadette, the World Health Organization has not issued any statement just yet about this virus or anything to worry about, even in the state that China is reporting. Do you think it even requires a worry to that extent that we should all look out for a statement from WHO?
No, I don't think so. As I said, it's just a yearly winter virus that we all go through. And you just keep these regulations like not shaking hands, keep good hygiene, and then it's going to be fine. There is no worry. And I agree with the WHO that there is no concern.
So let me also ask you, is there a separate vaccine requirement, or is just oral medication enough? And should we go back to the days of wearing masks? What would you recommend?
Well, at this moment, there is no medication and there are no vaccines, and there will not be within the first 1 or 2 years. The RS virus, which is closely related, the first vaccines are getting on the market for that. But I think for metapneumo, it will take another few years. Yes, you can wear masks if you have a cold yourself and you want to protect people around you. But you can do that also, and vice versa, right? Protecting yourself. But you do that for other respiratory viruses as well, like influenza, RS, rhinovirus. So in the common cold season, you have to be a little bit more careful if you don't want to get a cold.
Okay. Dr. Raman. Dr. Raman, since we're talking about younger children and elderly people being more susceptible to catch this virus, are there any specific do's and don'ts that you would want to recommend, especially for Indians here?
No, basically, this is one infection which cannot be avoided. No. Children are going to get infected. Now, the only way to reduce the risk of transmitting the infection perhaps could be those who are infected and those who have symptoms. Let's not put it as infection, because we don't want to recommend testing for HMPV in all common cold cases. What they should follow is they should follow COVID appropriate behavior if they have a child which is less than 5 years. But does that mean the child is not going to get it? Child will get it one time or the other. And perhaps, I would add to it that these repeated infections, there is a good study done in China where they showed that at the age of 5 years, 100% of these children had antibodies against this particular virus, which essentially means you are going to get it. This is a milder infection. You don't need to think that your child is going to succumb to this particular virus. And perhaps the subsequent infections that would occur have also been shown from European studies that they tend to be partially protective. And that's why, to my mind, we don't need to worry about this infection as much as we are currently believing on social media related messages. Trust the medical faculty.
Well said, and that really comes as something that would actually make all of us citizens aware. But Dr. Bernadette, before I let you go, just one question. We're not going to see, any of those screening, machinery and paraphernalia at airports, I hope. But what are the symptoms that people should watch out for, in which case they should go and get it tested for the HMPV virus?
The symptoms are very variable, but it's a runny nose, sore throat, and a cough.
Okay. So that means half of every country, or maybe more, would be running to get this test done. Unless it gets very serious, no test to be done. Should I take it as that?
Yes, indeed.
All right. Thank you very much, Dr. Bernadette, and thank you very much, Dr. Raman, for joining me. Extremely informative. There's no need to panic, viewers. Take a deep breath. Just treat your cold like a normal, common cold, and just relax. No need to run for getting yourself tested for the virus just yet. We'll wait for more information to come in. But for now, thank you very much, doctors, for joining me on the News Hour tonight. With that, it's a wrap on the News Hour. Thank you very much for joining me. Good night and be safe.